Hi, everybody. My name is Molly Hoffman, and I'm the Director of Care Coordination and System Development at UIC's Division of Specialized Care for Children.
And hi, everybody. My name is Stephanie Leach, and I'm the Assistant Director of Operations for the southern part of the state for our home care program, and also the HFS liaison.
So we wanted to first start out by saying hello to the participants, family members, caregivers, and other interested stakeholders who might be taking the time to watch this short presentation today. We have a unique opportunity to be able to get feedback from families and interested others, and a short window of time in which we're able to do so. So Stephanie and I wanted to start out today by telling you a little bit about something exciting that's coming up. DSCC was recently notified by our partners at the state's Medicaid program that the state has received some direction from federal CMS related to the American Rescue Act. The good news is that federal CMS is allowing additional funding to states to help enhance, expand, and strengthen home and community-based supports. Right now, the direction from federal CMS to the states is that they have to submit ideas in writing back by June 12th. This is a very tight turnaround time. We thought that today we would review with you the updates from federal CMS, share with you some feedback that we've received from other caregivers, review some suggested ideas that DSCC has, and share with you a mechanism in which you can provide your feedback or suggestions. So I'm going to turn things over to Stephanie, who will talk a little bit more about what we've heard from federal CMS.
Hi, everybody. So we want to give you a little bit of background, what exactly we're talking about. We're talking about the Federal Medical Assistance Percentage, otherwise known as FMAP. It's actually a section within the American Rescue Plan Act of 2021. So what this means is that states, including Illinois, can qualify for a temporary 10% increase from the federal government for certain expenditures that we use for home and community-based services, otherwise known as HCBS. Fortunately, the medically fragile technology dependent waiver is a HCBS program. So the waiver funds actually qualify for that 10% increase of federal funding back to the state of Illinois. The crazy thing about it is that FMAP expenditures, they must be between 4/1 of 21 and 3/31 of 22. And then the state of Illinois has to meet certain program requirements. So within those requirements, there's different appendixes that help us look for the utilizations and overall qualifications of the services we want to provide under FMAP. So for Appendix B, which is basically the eligible Medicaid covered services, they offer a few varieties of services, including the home health care, which of course is nursing care, medical supplies and equipment, personal care services, and those services the federal government looks at basically is assistance with daily activities, self-directed personal care. Some waivers have a self-directed portion, and the FMAP could fall in line with those. Case management, and that's just simply gaining access to needed services. School-based services, which are part of the medical assistance included in the IEP, must be mentioned in the IEP. Rehab services, and that's either medical or remedial. And then as well as private duty nursing. And of course, as we know, those nursing services providing continuous care to the individuals within the waivers. Another thing that the federal government looks at is what we would view as activities to support COVID related to home and community-based services and the needs for those services. So some options that we could look at that could be approved for the increase via FMAP are increased access. So what this means is increased access to the community. We can provide new services or additional access to those services. It could also be a provider payment rate or benefit enhancement, which basically is essential to a rate increase. Supplies and equipment, such as PPE and COVID-19 testing supplies. Workforce support. This could include recruiting and retaining home health workers during the pandemic. Caregiver support. This supports the family caregivers, which can include payment to them as a service provider. Support to provide functional capabilities. This basically would encompass assistive technology, transition support, and this includes the cost and coordination of the transition, mental health and substance abuse, and that's rehab support and capacity building for mental health and substance abuse. Outreach, which includes the education and language assistance for outreach, and can include access to COVID-19 vaccines. This could be the scheduling, the transportation, and maybe even having the vaccines in home. So these are all activities to support that could be included in FMAP.
Thanks, Stephanie. So before sharing some of the ideas that DSCC had, I wanted to share with you a summary of some feedback and ideas that I recently obtained from caregivers of children with medical complexity in April of 2021. The intent of the focus groups was to inform a policy analysis project, and it was not known at that point in time that the federal guidance related to the FMAP increases would be coming. There were 4 questions that were used to guide discussion during the focus groups. And today, I'm just going to be providing a condensed kind of summary of the findings, really focusing on the 2 first questions about your experience as a caregiver in Illinois, and what you see as the biggest challenge in trying to provide care for a child with medical complexity. And the second one about what ideas caregivers might have about how the state can improve support for caregivers of children with medical complexity. And so in response to that first question about caregiving issues, the feedback that was resoundingly heard from the parent participants was that the system is difficult to navigate, that providers aren't aware of the programs that can help, that there needs to be better linkages with other programs of assistance, that resources through the school are often unclear, that finding high quality, reliable nursing care in the home setting is a challenge. There were concerns expressed about pay rates for caregiving assistance, and that applies to nurse and others. The bureaucratic language is difficult to understand, that there's a sense of bias in the system that parents shouldn't need help to care for their child, that there's a lack of confidence in service coordinators and at times care coordinators, that there isn't a clear place to help go to get a resolution to problems or concerns, and that the variation between different states makes it difficult to understand services that are available, especially for families who have to relocate. And suggestions for improvement are listed here. What we heard from families during the focus groups was that it would be great if there was additional information that was available online about services, that they'd like to see requirements in writing where they can reference them. There was suggestions that family caregivers should be able to be paid even if unlicensed, that more parents should be involved in system development and improvement, really then leading to more transparency in the overall programs and support, that there should be improved planning in the transition to adulthood, improvements to make the systems easier to navigate, that it would be great if there was a menu of waiver services and a way to look at what services were available through other waivers, that they would like to see a more consistent enrollment process, and suggestions about cross-training related to home nurses to help assist in coverage gaps. Now I'd like to share with you a few of the suggestions that DSCC had developed as potential ways to utilize the increased FMAP to enhance, improve, and strengthen the home and community-based supports related to participants in the home care program, and to be able to hear your feedback. One of the suggestions had to do with expanding consumer direction. And what this means is that individuals enrolled in the home care program, and we would encourage that this be explored for both individuals in the MFTD waiver and in the non-waiver program, looking at ways for parent and family caregivers to be eligible to become paid caregivers for their child, even if unlicensed. DSCC would then work to develop health and safety monitoring, assist with training, and work to help establish a fiscal intermediary. The second suggestion for improvement had to do with developing a nursing portal where open shifts could be posted by nursing agencies and families and would then be visible to home nurses. The intent would be to try to improve nursing coverage for open shifts across the state. And the third recommendation would be a suggestion that HFS consider creating single entry points for services. Now we'd like to hear from you. We ask first, what is your response to the suggestions that DSCC has developed? What concerns do you have about them? Please note that these are simply suggestions. Nothing has been approved, nothing has been decided upon, and nothing has any plans at this point for implementation. They are merely suggestions that come from feedback. We would like to hear what you think about them. In addition, we would like to hear additional ideas or suggestions that you may have. As I said before, the window of time for providing this feedback and developing suggested ideas is brief. Please send us an email to dscc@uic.edu with the subject of FMAP feedback, and please send this by June 6th of 2021. We appreciate your time and listening to this brief presentation today. Both Stephanie or I are happy to answer any questions that you may have. And we encourage you to please share your feedback and encourage others to share their feedback as well at the email that is provided. Thank you.